Asthma is a disorder that causes the airways of the lungs to swell and narrow, leading to wheezing, shortness of breath, chest tightness, and coughing. Asthma symptoms. Most people with asthma have attacks separated by symptom-free periods. Some people have long-term shortness of breath, with episodes of increased shortness of breath. Either wheezing or a cough may be the main symptom. Asthma attacks can last for minutes to days, and can become dangerous if the airflow is severely restricted. Symptoms include cough with or without sputum, phlegm, production, pulling in of the skin between the ribs when breathing, intercostal retractions. Shortness of breath that gets worse with exercise or activity. Wheezing, which comes in episodes with symptom-free periods in between, may be worse at night or in early morning, may go away on its own, gets better when using drugs that open the airways, bronchodilators. Gets worse when breathing in cold air, gets worse with exercise, gets worse with heartburn, reflux. Usually begins suddenly. Emergency symptoms: bluish color to the lips and face, decreased level of alertness, such as severe drowsiness or confusion during an asthma attack, extreme difficulty breathing, rapid pulse, severe anxiety due to shortness of breath, sweating. Other symptoms that may occur with this disease: abnormal breathing pattern, breathing out takes more than twice as long as breathing in, breathing temporarily stops, chest pain, tightness in the chest. Asthma treatment. The goal of treatment is to avoid the substances that trigger your symptoms and control airway inflammation. You and your doctor should work together as a team to develop and carry out a plan for eliminating asthma triggers and monitoring symptoms. There are two basic kinds of medication for treating asthma: control drugs to prevent attacks, quick relief drugs for use during attacks. Control drugs for asthma control your symptoms if you don't have mild asthma. You must take them every day for them to work. Take them even when you feel okay. The most common control drugs are inhaled corticosteroids, such as Asthmanex, Alvesco, Quvarorobid, Flovent, Pulmicort. Prevent symptoms by helping to keep your airways from swelling up. Long-acting beta-agonist inhalers also help prevent asthma symptoms. Do not take long-acting beta-agonist inhaler drugs alone. These drugs are almost always used together with an inhaled steroid drug. It may be easier to use an inhaler that contains both drugs. Other control drugs that may be used are leukotriene inhibitors, such as Singler and Ecolate, omalizumab, Xolair, cromolyn sodium, Intal, or natocromyl sodium, Tilid, aminophyllin or ethifillin, rarely used anymore. Quick relief drugs work fast to control asthma symptoms. You take them when you are coughing, wheezing, having trouble breathing, or having an asthma attack. They are also called rescue drugs. They also can be used just before exercising to help prevent asthma symptoms that are caused by exercise. Tell your doctor if you are using quick relief medicines twice a week or more to control your asthma symptoms. Your asthma may not be under control, and your doctor may need to change your dose of daily control drugs. Quick relief drugs include short-acting bronchodilators, inhalers, such as Proventil, Ventolin, and Zokinx. Your doctor might prescribe oral steroids, corticosteroids, when you have an asthma attack that is not going away. These are medicines that you take by mouth as pills, capsules, or liquid. Plan ahead. Make sure you do not run out of these medications. A severe asthma attack requires a checkup by a doctor. You may also need a hospital stay, oxygen, breathing assistance, and medications given through a vein, IV. Asthma care at home. Self-care skills that are important in taking care of your asthma are: know the asthma symptoms to watch out for, know how to take your peak flow reading and what it means, keep a phone number of your child's doctor and nurse with you, know which triggers make your asthma worse, and what to do when this happens. Children with asthma need a lot of support at school. They may need help from school staff to keep their asthma under control, and to be able to do school activities. Asthma action plans are written documents for anyone with asthma. An asthma action plan should include a plan for taking asthma medications when your condition is stable, a list of asthma triggers and how to avoid them, how to recognize when your asthma is getting worse, and when to call your doctor and nurse. A peak flow meter is a simple device to measure how quickly you can move air out of your lungs. It can help you see if an attack is coming, sometimes even before any symptoms appear. Peak flow measurements can help show when medication is needed, or other action needs to be taken. Peak flow values of 50% to 80% of a specific person's best results are a sign of a moderate asthma attack, while values below 50% are a sign of a severe attack. Asthma is a common disease, yet every individual needs unique treatment and care. We encourage people with asthma and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about asthma and how to treat asthma, just click on the link at description or visit www.mainmd.com. Thank you.